Hello and welcome to Christian Aid Cymru. We're in the middle of Christian Aid Week, and as we all know, we're all having to do Christian Aid Week very differently this year because of the coronavirus. Indeed, Christian Aid's work is having to adapt all over the world because of the virus. And I'm very pleased that Amanda Mukwashi, the Chief Executive of Christian Aid, is able to join us today and talk a little about this work, especially in one part of the world, in Coxs Bazar in Bangladesh. Amanda, thank you so much for joining us and welcome.
Thank you very much, and hello, Cymru.
Really good to have your company. Let's begin then by talking about this one particular place that we're working with today, and that's the refugee camp in Bangladesh, the camp for the Rohingya refugees in Cox's Bazar. Let's begin by talking a little bit about why we have this refugee camp there in the first place.
Okay, first of all, let me just say thank you again, and I hope that you're all keeping well and safe in Wales, and that we will have occasion once again at some other time to meet physically in the same space. I think that Cox's Bazar is one of those places that in a world such as ours, you would hope that we wouldn't see and we wouldn't need to have. But in 2017, in August of 2017, there was a mass exodus of the Rohingya from Rakhine State in Myanmar, in Western Myanmar. And they were fleeing persecution. They had, the United Nations reckons that there were serious human rights violations there. And this was not the first time, unfortunately. They had been under persecution for decades in Rakhine State. They had been stateless. And so in August, in a period of 1 month, more than 500,000 people left their homes to try and cross the border into Bangladesh. At the moment, I think there are more than 850,000 Rohingya refugees who live in Cox's Bazar in Bangladesh.
That's a number that it's so difficult for us to imagine, isn't it? We're only 3 million people who live altogether in Wales. So to have a camp of refugees of 800,000 is just beyond our understanding. But you've been there, you've spent, I think, a couple of days there a couple of years ago. Tell us a little about your experience and what you saw there and how you felt about being there.
I visited Cox's Bazar, and particularly in Jamtoli camp, which was being coordinated by Christian Aid at the time in the summer of 2018. And I think it was my first visit after I had joined Christian Aid to one of its programs. And I have to say that I was very affected. I was very affected because I couldn't remember seeing anything like it in my adult life. Jamtoli camp is home to about 50,000 of those 850,000 refugees, all sort of sit in one place with temporary shelter. I was able to meet with families. I was able to talk to the women. I spent a bit of time in women sort of safe spaces and heard some quite horrific stories. I think one that I've spoken about over and over again was the woman who, because of course we were not allowed to build a permanent shelter, it was not safe. The doors are not permanent, and so they can easily be broken down. And she had two daughters. I think one was 12, the other one 14 or thereabouts. And I said to her, "What is your biggest concern?" And my expectation was that she would say to me, "You know, I worry about food. I worry about the fact that I'm not home." Her biggest concern was that every night she had to sleep by the door. So that if anybody came to attack her daughters, they would have to go through her first. And I could tell you story after story of the things that I heard. But no woman, no child, nobody should have to live in such extreme fear just for their life, just because they come from a particular social group of people in the world. But I was very pleased that, you know, our work with there was very good, and we were able to actually help quite a number of people. But yes, I visited, and it was a privilege for me.
And yeah, quite a traumatic experience in itself, it would seem. So tell me a little bit about what Christian Aid has been doing there in the camp, taking care of these people.
So our sort of normal humanitarian response has been really to, like the woman I'm talking about, making sure that we were able to negotiate, for example, with the UN agencies and the government, so that we could build a safer place for her. So not a permanent structure, but something that was not as easily broken into as what she had. And then we had we're working with partners. I think we're working with over 50 partners, local actors in that area, providing, for example, training for women in terms of safety, in terms of skills for the future, or skills that they could use there and then and keep themselves busy. We worked with health partners on a clinic because there wasn't access to healthcare services. And so we were able to provide support for that. But I think the best one that I had, that I really, really liked, was the fact that there was no water. And you had, let's say, the elderly, most vulnerable, who couldn't go up and down the hills. They would stay and not have anything. And so being able to use solar power, solar energy, to actually bring water closer to their homes, that was something that was actually very good. But of course, with COVID-19, our work has now been repurposed. And now we are focusing on making sure on two things: prevention and containment, trying to make sure that, you know, we are, in terms of prevention, that our partners are working with the communities there to teach them hygiene, how to wash your hands, making sure they have soap, making sure that that water is there, making sure that there is a little bit of power that they could use. So just going back to basics around how can we prevent you know, the transmission of the virus as much as possible. Of course, you know, the challenge is that how do you ensure social distancing in a small place that is home to 50,000 people? That's one of our biggest challenges.
Yeah, it must be so difficult, if not impossible, in such a crowded place. And then there are the other challenges of lack of soap and lack of water. I think I've read somewhere that only 1/3 of the households there, or 1/3 of the households don't have soap at all, which again, for us, is unimaginable. I don't think I've ever run out of soap in my life.
Exactly, yes.
But here we have 1/3 of households without soap. So the work we do there is very, very crucial, Amanda.
It is, and it's not just you know. So you are talking about soap, you know, something that we take, at least I take for granted, is that I can get up from my seat, you know, go to my kitchen, open the tap, and water is going to come out, right? And I'm sure that most of us don't even think much about that. You know, we take it so much for granted. In Coxs Bazar, there isn't that. There's no running water as such, right? And so, you know, when you find, I think recently they say there were about 15 cases of coronavirus that were confirmed in Cox's Bazar. And you can imagine the level of fear and anxiety. And some of the work that we're doing there as Christian Aid has to also be about just psychosocial support, working with partners to make sure that that fear doesn't paralyze the inhabitants of Jamtoli camp, for example. but I just can't imagine. I wish that I could. And even when I know that as Christian Aid, we are doing everything that we can, from, like I said, hand washing, hygiene, trying to see how women can be protected, containing them. I still can't help but walk away feeling like, could we do more? What else can we do? Are we doing enough? And those are the questions that I'm asking myself all the time. And I'm sure that my colleagues are also asking themselves those questions, because when you look at this situation, it's really quite dire. And but I think the best that we can do, David, is just really you know, to give our best, you know, and be true to who Christian Aid is, which is, we were set up. I mean, when I think of the fact that we're 75 years this year, and it was V Day the other day, and it's a timely reminder of why we were brought into existence, to try and alleviate suffering and be there for our neighbors, not just here at home, but our neighbors far as well. And I think that's what we're doing in Cox's Bazar.
In all the problems that you've witnessed, in all the facts that we hear, of the disturbing stories that we hear, where do you find hope, Amanda, in such a time?
For me, I think that, no, it's not that I think. I know that my hope is in my faith. My hope is in Jesus Christ. What has happened during this lockdown? I mean, we've been working from home now we've been under lockdown, I think, for 7 weeks.
That's right.
And it's easy to lose hope. But to the contrary, I think that I am more hopeful now than I have ever been. I've been speaking to our country, our staff in different countries, and in every conversation that I've had, they would describe to me the situation and how bad it is. They'll talk about the domestic violence, gender-based violence. There's an increase in violence against women and girls in almost every country that we're working in, right? They'll talk about food insecurity. They'll talk about hygiene issues like we've been talking about. And yet, they'll also talk to me about the fact that, you know what, we're going to overcome. This will pass. And the resilience of the spirit that they're showing is amazing. And what it does to me is just, it tells me, Amanda, you have no basis for not having hope. And members of staff have reached out to me, supporters have reached out to me. I've received short messages, email, let's just say, we're with you, we're thinking, and we're praying for you. And there, that's where I find hope. I find hope in the Word of God, that the Bible says to me that I'll be there for you. You can seek shelter under my wings, and that's what we need to do at this time. We need to find shelter under God's wings.
That's a fantastic place with which to finish this interview. But what one word of encouragement would you give to the supporters that we have all across Wales who are working hard at this very moment?
Well, I don't know if I can manage one word, but the last time I visited Wales, the warm welcome. I remember the singing. I remember the happiness, the joy of being in that space. And I think there were about 300 supporters in that room. What I would say to you is, don't lose your heart. Don't lose heart. You have been amazing in your support and your journey with Christian Aid. You've been there in difficult situations, and we'll get through this. I think each one of us is worried about our own health, the health of our families here at home. And I think it's important for us to take care of ourselves. So what I would say is, take care of yourselves. Make sure that you're healthy. Make sure you're staying home, you're socially distancing, but let's connect in prayer and in who we are as human beings. And let's just pray that we shall be in the same space again soon. So for now, let's stay connected and let's continue standing together Thank you so much for everything that you do for Christian Aid. But I will also be praying for you and your families.
Amanda, thank you so much for joining us today. I know that message will be an encouragement to all our supporters to keep going during Christian Aid Week. And we also will be praying for you, and we look forward to welcoming you back to Wales, hopefully very soon.
Thank you. Thank you so much. And all the best to the team as well.
Thank you very much. Take care. God bless.
God bless. Bye-bye.
And thank you too for joining us today to listen to this short interview with Amanda Mukwashi, our Chief Executive. I'm sure you have been inspired by what you have heard. Bless you as you continue to raise money and to pray and to raise your voices during this Christian Aid Week. Our work is as required today as it has ever been. So thank you for all that you do. God bless you and goodbye.